This is the first of 4 videos that are going to go over the mechanical activity of the heart and its associated activities in the form of the cardiac cycle. This video will just be a brief introduction to what I'm going to present, how I'm going to present it, and what I expect for students in my classes. First and foremost, when I go through the cardiac cycle, I'm focusing on the left side of the heart. That's the side of the heart we measure blood pressure off of. That's where our focus will be. Just remember, the left and the right side of the heart are doing essentially the same things, more or less at the same time. So whatever happens on the left side applies to the right. The only substantive difference between the left and the right as far as the cardiac cycle is concerned is that the magnitude of pressures in the left side is much, much greater than it will be in the right side. But in simplest possible terms, the pulmonary and aortic semilunar valves open and close on both sides of the heart for, in essence, the same reasons. So if you understand one, you understand both. Second, unlike really all the A&P textbooks out there, I'm not going to begin the cardiac cycle with the P wave of an electrocardiogram. I've never liked that convention. It doesn't actually make logical sense to me because that's looking at electrical tracings of activity through the heart and not pure mechanics. Here's my reasoning for starting with ventricular contraction or systole rather than trying to synchronize off the EKG. First of all, the EKG is about electrical activity. The cardiac cycle is about mechanical. And the mechanics of the heart really are driven by what the ventricular myocardium is doing, not by what the atria are doing. It makes more sense to me to begin either with the ventricle contracting or with it relaxing as my starting point, since that's what's driving everything, rather than beginning, in essence, halfway through relaxation of the ventricle just to synchronize with the EKG. The other reason is a little more practical than that, and that's that the average healthcare provider doesn't spend their time day in, day out with electrocardiograms, but they do spend their time dealing with blood pressure a lot. If you focus on systole and diastole of the ventricle, then by beginning with ventricular contraction, you're beginning with systole and systolic pressure, and you're ending with diastole and diastolic pressure. That to me makes more logical sense. Now, I'm not going to contradict anything substantially that's in any textbook. This is a cycle, so frankly, anybody who tells you you have to start this cycle at point X is really messing with you. It's a cycle. The same events over and over. Whether you synchronize with the EKG as your starting point or you begin with the onset of ventricular contraction, it's the same cycle, and it's just a matter of knowing the events that occur in the proper sequence. Starting point really doesn't matter in the end. Finally, for students in my classes, I want them to focus in each phase of the cardiac cycle on the big 4 elements. Now, what do I mean by that? The big 4 elements are atrioventricular valve status. Is the bicuspid valve opened, closed, opening, or closing during the time frame in question? Semilunar valve status. Is the aortic valve opened, closed, opening, or closing during the time period in question? Ventricular pressure. Is pressure in the ventricle increasing, decreasing, or remaining constant during the time period in question? And ventricular volume. Is it increasing, decreasing, or remaining constant? And if it's constant, at approximately what value? These are the things I want you to focus on during each step. The remaining videos will go through an illustrated view of the cardiac cycle happening, a summary of how to bring together all the elements, say if I were to ask on a test to summarize a particular phase of the cardiac cycle, and then the final video will look at the heart sounds and the concept of cardiac output.